This episode is based on a true story. Some scenes have been dramatized. Always consult your doctor for medical advice.
Here in the land of two seas, Bahrain, healthcare is one of the priorities in the kingdom. Health, as we all know, is important for human happiness and our well-being. And at Health Hub, we answer your common questions and bring to you information about the advanced medical facilities in Bahrain. In today's episode,
So Dr. Faisal, our topic today is on a specific type of arthritis called psoriatic arthritis.
And all of a sudden one day I woke up with this blinding pain in my foot.
This X-ray will tell us if there is delay in treatment. So as we know, psoriatic arthritis affect different part of body like joint, back.
Many of us have heard about arthritis, or in other words, joint inflammation. But have you heard about arthritis being accompanied by a skin condition called psoriasis? I am Dr. Khawla, and we have dedicated this episode to learning more about the condition psoriatic arthritis. Good morning.
Good morning. Welcome, Dr. Paula.
Thank you, Dr. Faisal. Thanks for having us.
Welcome.
So Dr. Faisal, our topic today is on a specific type of arthritis called psoriatic arthritis. Can you tell us a little bit about this condition?
Okay. So psoriasis of skin or psoriatic arthritis, both are autoimmune disease. And I will, for general people, I will explain what is the autoimmune disease. Actually, we have some cells in the body which are to protect our body from harmful germs, but in autoimmune disease they start hurting our own organ of the body. So if it is skin, it can cause psoriasis, for example, and if it affects the joint, it will cause psoriatic arthritis. So some patient has only psoriasis of skin and some have psoriasis of skin plus arthritis.
Okay, and if you have both, it's called psoriatic arthritis.
Yes.
Very good. So what are the common usually symptoms that people have?
So in my clinic, mainly patient come with, because I am rheumatologist, so they come with joint pain, they have stiffness, and it also affect the joint of the back. So patient may have back pain, stiffness, and it can affect the tendons of the body. So patient may have heel pain, and sometimes they have skin rash, but they usually come through dermatologist.
Very good. Now, a lot of the public have a lot of back pain or sometimes knee pain. Is that arthritis or psoriatic specifically arthritis?
So you are quite right, because back pain is quite common problem in general population, but this pain is especially what we say in medical term inflammatory back pain. That patient feel when he get up in morning, when he start moving, so he feel better. While the other common type of back pain, patient is good in the morning, and when he start doing his work, when he bend forward, he feel more pain. So this is very important difference that people should know. Again, knee pain, somebody who is overweight is quite common in our population, but inflammatory type of arthritis is more in the morning with swelling and with stiffness. So these symptoms people should know. So they should consult their rheumatologist early.
Very good. So if it's joint pain, but it's worse in the morning when you haven't done anything and actually gets better with movement, we're thinking along the lines of arthritis,
exactly,
rather than the typical, stress-related back pain sort of thing. Very good. If you're suspecting, doctor, psoriatic arthritis, what type of tests do you do?
Actually, again, psoriatic arthritis, we have no special test for psoriatic arthritis, but we will do some tests like rheumatoid factor and other tests to rule out the other type of arthritis. And we can do X-ray of the involved joint. We have ultrasound, we have MRI, every facility is available. But at the end, this is the rheumatologist who put the different pieces and make the diagnosis of psoriatic arthritis.
So Dr. Faisal, I heard we have a patient today who's, had quite the journey with psoriatic arthritis.
Yeah. So I have luckily one patient who is suffering from psoriatic arthritis, and he has joint pain quite for a long time, and he doesn't know that it is common joint pain or it is due to psoriatic arthritis. So he was going to different doctors and they were giving some medication to relieve his pain, but he was really suffering. He cannot get up in morning, he has pain, stiffness, and which was affecting his life and family life, his job. So we will see that patient.
Very good. And from my understanding, Dr. Faisal, the regular painkillers are not enough for this type of joint pain.
Yes.
Right?
We can give for short time, but you know, again, these painkiller has on their side effect. And in psoriasis of skin, they can worsen even the skin condition. So they are not the ideal drug. We have now better drug for treatment of psoriasis and psoriatic arthritis.
And you use drugs to treat the underlying problem, and that is the problem with
Yes.
the immune system attacking our
yeah.
own organs.
And in the treatment of psoriatic arthritis, we have to prevent joint damage. We will discuss further in detail. And so this painkiller or non-steroidal, they will not prevent the joint damage. Now we have good medication and a lot of medication, I will say, which can prevent joint damage.
Excellent. So let's go see the patient, if that's okay.
Well.
Hello, Christopher.
Hey, doctor. How are you?
Good. How are you?
Good, thank you.
Hello, Mr.
Dr.
Christopher.
Faisal.
How are you doing?
Good, thank you very much.
Yeah. So how's your joint pain now?
Joint pain, alhamdulillah, it's okay.
Good, very
Not
good.
so bad.
Do when you get up in morning, there is any stiffness in joint?
Not so much now. Last year, before the Humira treatment, there was, but now not so much.
Okay. What about your skin?
Skin is perfect.
Okay, so
Skin is perfect.
this is good. Everything is going in a better
Exactly.
way.
So before I had the psoriasis in the scalp and so on, and now nothing.
So one drug is taking care of all.
Taking care,
That's
exactly.
good.
Exactly.
Okay. And did you notice any side effect of this treatment?
Not really too much. Nothing in particular.
Good.
But,
That's great.
yeah.
That's great. So I will just examine your hand. Okay. I press. There is any pain over the
Nothing.
joint? Okay.
Nothing at all.
So
So
we
walk
can,
us-
we can see Dr. Khola, there are some changes in his hand, okay, which is due to his previous disease because he has psoriatic arthritis for some years.
Yes.
But good thing there is no swelling, there is no pain and stiffness, which are marker of activities.
So swelling, pain, and stiffness means the disease is active.
Yeah.
Okay.
And we are running some tests from time to time to see there is disease activity. But definitely what patient feels is very important to, as a physician, as a doctor as well. Okay? Yeah. Even you can see his feet. There are a lot of changes. But when he came to me, he has even difficulty in walking because his
Yes.
ankle were quite swollen and painful. But now we can see they are good. I press, there is any pain?
Nothing.
Okay. So he is doing, to me, he is in remission.
Very good.
In our term we use, his disease in remission. From his joint point of view, from his skin point of view, and his general well-being.
Very good. Thank you, Christopher,
No
for
problem. Thank you.
taking the
Mr.
time.
Christopher.
Thank you very much.
Welcome.
Since the diagnosis, the effect is not that great, thanks to the medication and the things that the doctor is doing. I actually got diagnosed around 15 years ago, when I was like 21, 22 years old. And basically for me what happened was I was walking a lot for my job. I was very fit at that age. I was walking a lot for my job. And all of a sudden one day I woke up with this blinding pain in my foot and I didn't know what it was. So, you know, for me at that point I was walking a lot for work and I reached the point I couldn't walk, you know, even at that age, you know, and it was quite concerning for my family as well, you know, my dad having a son that was struggling to walk a little bit and so on, and the pain that I was in. And for me, I went to a few doctors back home in the UK, etc. And the problem with PSA is it's quite a new disease. It's quite a new discovery. So not a lot of people at that time, 10, 11 years ago, actually knew about it. So it took a while to get diagnosed. And there was an effect on my work and everything at that time. Since being diagnosed and now having access to the medication that helps and also the diet a little bit that helps and things like that, it's been much, much better, and the effect on my life is now minimal, I would say.
So, Dr. Faisal, we've seen some very interesting findings in our patient, both hand and feet. Can you show us the x-rays of those?
This x-ray will tell us if there is delay in treatment. It can cause a lot of damage to the joint. You can see here some fingers are in good shape, but some fingers are quite affected.
Yeah, so the good shape are in straight lines,
yes, you
whereas
can see
that one is mostly like a zigzag form.
You are quite right. So I will go to now the x-ray feet, which are more affected.
Yes, the feet were definitely more visibly affected, even on exam.
You can see here again these finger of foot should be straight. They are gone outward. All the fingers are affected on both sides.
That's pretty advanced arthritis, correct?
But still we have to treat to prevent further damage. But good thing is patient has now no joint pain or stiffness. So he has some deformities, but he is doing his spending his life normally. He can walk, he can go to his office, and he has no pain or stiffness now.
Very good, and that's with the drugs that we've used to treat his condition.
Yeah, we have now a lot of medical treatment available for psoriasis, and now we will go to pharmacy to show what option we have for treatment of psoriatic arthritis.
Wonderful. Thank you, Dr. Faisal.
Welcome.
Let's go. So, Dr. Faisal, talk to us about the treatments available for psoriatic arthritis.
So, as we know, psoriatic arthritis affect different part of body, like joint, back, and tendon. So, it involves multiple specialties like physical therapists, dermatologists, rheumatologists. So, but medication are important part of treatment.
That's right.
So, we have some medication which are given usually in tablet form. These are called disease modifying agent because they prevent joint damage.
And these are not your usual, ibuprofen that you take for pain.
That is for pain, and they have temporary effect. They do not prevent joint damage. So, but these medication prevent the joint damage. We have like in tablet form. If they are not working, we have injection form, same medication. So, some patient, most of patient respond, like up to 60% respond to these treatment. But sometime patient do not respond to treatment. This treatment, then we have some advanced treatment which is called biological therapy. We have one injection available with us. So there are different types. This is one I'm giving you just one example.
Yes.
So these are in injection form, which is given like this injection is given every 2 weeks, but we have injection which is given even every month. So it all just to improve the compliance of patient. And now the good thing is we have the same biological treatment available in tablet form as well. So some patients are afraid of needles. We can offer them that. But this is rheumatologists who can decide, because this medication has different effect on different patients.
That's right. So a lot of people, when they think about treatments for the arthritis, especially the advanced treatment, they're worried about their immune system. Can you tell us a little bit about maybe complications that might happen and how to prevent them?
Yeah, this is very important because definitely these medication affect the immune system. So we have to prepare patient. We have to screen for any occult infection in the body. We do some x-rays and run blood tests, and we vaccinate patient before starting this therapy.
Very good. So you take all your precautions before you do something or you give it.
And these are quite safe after that.
Quite safe after that. Very good. Thank you. Thanks, Dr. Faisal.
Welcome.
Did you know that psoriatic arthritis affects men and women equally? In addition to that, the condition psoriatic arthritis generally starts with the skin manifestation first, and that is the psoriasis. The psoriasis is then followed by the arthritis or the joint inflammation. In addition to that, not everybody with psoriasis will develop arthritis. Only about a third might develop the joint inflammation or the arthritis picture in addition to the psoriasis. Now, scientists don't really know exactly why some people develop arthritis versus others. They think it's a combination of immunological triggers, environmental triggers, in addition to gene factors.
My name is Dr. Faisal Naseeb. I graduated from Pakistan and did my training in internal medicine and rheumatology from Pakistan. Then I moved to King Saud University, Riyadh, Saudi Arabia. I spent 12 years as rheumatologist there, and for 1.5 years now I am serving people of Bahrain. So we see a lot of rheumatological problem, but more common are rheumatoid arthritis, psoriatic arthritis, and high uric acid, which causes gout, and sometime I see ankylosing spondylitis, and also many patients of systemic lupus also I see.
Dr. Faisal's been great. We started a new treatment here of Humira, which I hadn't tried before. And Dr. Faisal, we weighed up together. What I liked about Dr. Faisal was that the decision was made together. So the two of us made the decision. He literally told me, this is the facts, this is the potential side effects, this is what the benefit will be, etc. And I felt involved in the decision-making process, which with some of the doctors, particularly back home, I'd felt like you have to do this, and that was it. There was no choice from my side. But Dr. Faisal and I almost worked as a team to get the treatment going.
I think these cases are usually missed out by the general doctors, and the patients are suffering due to pain, and they are saying this is just muscle pain, or they are not thinking it is something serious. So, and now there are a lot of advances. Now we have a lot of treatments available which with they can spend just normal life. So it is really interesting that new therapies are coming, and they are quite effective. So I will tell patient, because patient awareness is very important. So one single word: do not suffer in silence. If you have joint pain, if you have swollen joint, if you have stiffness in morning, don't take it lightly, because now we are talking about window of opportunity. If we start treatment within 3 to 6 months of the symptom onset, we can change the course of disease, we can prevent joint damage, we can improve quality of life. And also we are now talking about T to target, that we have to control this joint pain, inflammation to lowest level, so that joint damage is prevented. So if patient comes to us early, so we can help patient to just spend a normal life. I have many patients, if they came they came limping to my clinic, okay, and then if you see them, you cannot say they are patient, you will say they are just attendant. This is but patient compliance is very important. They should follow regularly whenever I am starting any treatment, because these treatments are side effect as well.
For me, particularly now, waking up in the morning, I don't feel pain. I used to feel a lot of pain first thing in the morning and so on. I imagine at 25, I felt like I was 65. But now, nothing. Now I'm up in the morning, I'm fine. My work is not affected. I can do anything I need to do. I can help the team in any way I can, and it's been great.
It is general healthy lifestyle. If somebody is in severe pain, initially we may ask patient to just take some rest. But when this inflammation or joint pain or swelling is controlled, we ask him to do light exercise. But definitely, if somebody has severe disease, we will ask him to avoid like strenuous exercise. And then good posture. Okay, maintain your weight, because if you have already joint affected by arthritis and you are putting extra weight on it, it will double the damage. And please avoid smoking, because if smoking, the disease progression will be more rapid. And even the advanced medication which I show you, studies has shown they become less effective. And some people are taking alcohol here because we have different nationality. So they should control their alcohol intake as well, because again we are giving some medication which can affect the liver. So these are all important education point which I try to convey to general people, and I'm telling the patient who are coming to me.
Every episode of Health Hub, our team brings you the latest and most relevant information to your own health. I'm Dr. Khawla. Stay safe.